Morning, everyone. I'm Dr. Attalla, and today we are talking about emotional regulation, and we're talking about part two. So, to start with this topic, we're going to talk about first how do emotion work. So, emotions start with senses. You see something, you hear something, you taste something, and from these senses, the signals that travel to your brain, and then it goes to somewhere like certain place in the brain called the limbic system, and the limbic system will feel the feeling. And I'm sure sometimes you taste something and it reminds you of something, and then you feel. Sometimes you hear certain songs and trigger certain feelings. Yes, you heard it through your ears, but the processing of the feeling, it happened through the limbic system. This is part in the brain. Part of this part of brain is part of it is called the amygdala, and part of it is called the hippocampus. Amygdala is the part that feels the feeling. Hippocampus is the part that memorizes the feeling. And then after the limbic system feels the feeling, it sends signals back to your other areas of the brain at your body, and which send signals to your body. Sometimes you feel with certain feeling, you feel heart racing. Sometimes you feel your muscle is tense. Sometimes with certain other feelings, you're gonna feel relaxed. Um, Sometimes you feel sweat, like you start sweating because of the feeling. So every feeling is different, and the effect on the body is different. Um, your emotions people ask me, okay, especially people with depression or anxiety, I wish I wouldn't have any of these emotions. I want to repress it. I want to get rid of it. Give me some medication I don't want to feel it. No, but your emotion is important to feel it. And because it is important for survival, it is important for communication, it is important for motivation, seeking pleasure, and avoiding pain. Um, I'll give you an example. If you're going downtown and all of a sudden there is a dog, big dog, start barking and start to attack you, and what you're gonna do, this is gonna trigger fear feeling. So you'll have feeling of fear. When you have this feeling, you're gonna in a nanosecond, you're gonna assess the situation and decide, are you gonna run away or are you gonna fight? Which we call it a fight or flight response. So in a second, you're gonna assess, oh, this dog is too big, I might need to run away now, or it's not that big, I can fight. So anyway, to run away, when you feel this feeling, the feeling will send the signals to other area of the brain. It's called the HPA axis, and it's gonna anyway gonna activate certain hormones in your body, and it's gonna activate certain part of the nervous system called the sympathetic nervous system. When this nervous system is activated, you're gonna have more muscle power. Your eyes will be widely open. Your heart start racing to pump blood to the muscles of the leg, so you can run faster. It's gonna increase your blood sugar, so it gives the muscle more nutrient to be able to run. The same time, it's gonna activate the adrenaline secretion inside your body, which is going to do the same function too. Um, this is important. Yes, it starts with all feeling. You'll be able to run away and survive because of this happen. This is the only function for the feeling and the emotion. No, there is another function for feeling, like communication. Let's imagine like you are walking downtown, and then one of your friends you saw one of your friends, and you like this friend, and you felt happy, and when you start feeling happy, you start to smile. Then your friend, when he or she saw you smiling, they realized that you are happy to see them, so they started smiling too. So The feeling is important in communication because when you felt it, you will be able to express it in your facial muscle by your facial muscles and the facial expression. Your friend was able to tell that you are happy seeing him, and he smiled, and then you start talking, and then you have plans for meeting. So the feeling is important in communication. Also in motivation, if something make you feel good, you're gonna keep doing it. If exercise make you feel good, you're gonna exercise. If making money make you feel good, you're gonna work harder to make money. If eating or drinking make you feel good, you're gonna keep drink. Why we drink? Like why? Because when we drink, we feel good. We feel relaxed. Why we eat? Because we feel good. And also, you're gonna avoid anything that cause pain. You're gonna avoid this because you're gonna feel pain first, physical pain or emotional pain. You're gonna try to avoid the situation and people and places and things that trigger the pain. Um, anyway, so feelings, if you feel it, no matter if it is pleasant or unpleasant, negative or positive, if you are able to process it, yeah, you will be able to achieve like mental health. You'll be able to achieve not just even psychological well-being. It will be psychological because we know that our feeling affect our body, so you'll and affect our soul. So you'll be able to, when you process your feeling in the right way or in a healthy way, you will be able to achieve psychological, physical, and spiritual well-being. So the first part that we need to learn is how to recognize your feeling. Um, I have this story. It is a long story, but it is important to go through it because we will learn some steps, important steps to address and assess your feeling and to identify and recognize them. So we have, this is Jocelyn. Jocelyn, she came from work. She found her husband drunk. Okay, her husband have a drinking problem, and he refused to consider any treatment because he doesn't believe that he has any problem, and this is common. So Jocelyn immediately she felt angry. She started screaming at her husband. She called him worthless drunk, and she wanted to hit him, but she didn't hit. She just called him and sweared at him. Anyway, after she felt angry, she started to feel hopeless and ashamed of the whole thing. And why she feel hopeless? Because she didn't feel like she could stay in this marriage, but at the same time she doesn't believe in divorce. She can't get divorced because she doesn't believe in it. So she doesn't know what to do. Then she started thinking about killing herself. But she didn't do it, and instead what she did, she started cutting herself. And as I mentioned before, that sometimes the cutting is make people numb their feeling and make them feel better, and there are sometimes it is addictive too. Anyway, she cut it herself. She started bleeding, and she slept. And before she sleep, she forgot to set her alarm because of all this emotional pain. Of course, she didn't remember to set her alarm, so she was too upset because of what happened, and she forgot to set the alarm. Anyway, she went to work late, and her boss was not happy. They told her, if you do this again, we will let you go. And this is the whole story. So what we're gonna do, I'm gonna ask you to process this. How we're gonna process this situation. Yeah, and I'm sure you have certain situations that could be similar, that trigger certain feeling, unpleasant feeling, from hopelessness to worthlessness to depression to anxiety to anger. You need to learn how to process the situation first, and then you need to ask you these 6 questions. So let's focus on this situation. So what happened and when? So this happened last night, and what happened? She went back. Like the first question is summarize what happened. So what happened? She went back. She found her husband is drunk, and she got angry. Then she started cutting herself. This is exactly what happened. Why do you think that situation happened? This situation happened because her husband doesn't seek help, and he have this addiction problem for a long time, and he doesn't believe that he has a problem. Then ask you, what did the situation make her feel, both emotionally and physically? Yeah, I'm sure she felt tired, she felt exhausted, but emotionally, what is his primary and second, one and two, I mean primary and secondary? Her primary was anger. She was so angry and she wanted to hit him, but she didn't hit him. And she called him names and you're worthless drunk. But her secondary feeling was ashamed, was hopeless. Was her secondary feeling. This is how we assess the situation. This is how we process the situation. Then we're asking you, what did she want to do as a result of how she felt? So we're going to ask you, okay, when you have this feeling, what did you want to do, or what did she want to do? Yeah, when you ask the situation, actually, she wanted to hit him, but she didn't. She wanted to kill herself, but she didn't. So what did she do? And what did she say? She told him, you are a worthless drunk, and she started cutting. This is exactly what she did. If this is healthy, of course this is unhealthy, but you need, because I see patients in the clinic, they come just with cutting, and they're telling you, oh, I'm cutting, can you help me? Yeah, I have this kind of addiction, weird addiction, I'm cutting. Or I'm drinking, can you help me? Or I'm doing this. And all of them are just negative, unhealthy coping skill that they learn, but they need to know why this happening. And why this happening, it is because of emotional pain. Believe me, in everything that we are doing, it is not because of our thoughts or what we think or we are logic. Everything what we're doing, I'm 100% of what we are doing is because of our feeling. That's why I need my patient. I want you to be able to connect your feeling with what you are doing. This is the first step. This is the first step in treatment. No matter if we're going to use dialectical behavioral therapy or cognitive behavioral therapy or using the meditation technique or mindfulness, it doesn't matter what technique you're going to use. First, you need to learn how to connect with your feeling. And through this step, you will learn how to do that. The last question is, how did her emotion and action affect her later? Yeah, it affected her negatively. How? Bleeding. She went to work late. Her boss was not happy. If she continued like this, she might lose her job. So this is how her feeling affected her. So this is exercise 1 for you. This is what I want you to do. The same thing, try to recall some situations when you reacted, when you have unpleasant feeling, and start to assess what happened and then when. Why do you think this happened? How did you feel about the situation, primary and secondary? And then what did you want to do? And then what did you do? And what did you do, how this affect you emotionally and physically, and what was some people will be a financial problem, some people will have legal problem, some people will have addiction issues, some people will have anger issues, unstable relationship. And believe me, it all starts with feelings and emotions. This is the first exercise, so I want you once a week try to remember one of the situations that happened and answer this question. And do this for 3 months. Every week, remember, one situation is enough. Will help you to connect with your feeling. The second exercise is describing your emotions out loud. How does this happen? You just, every time you feel something, you say, right now I feel sad. Right now I feel depressed. You say it. Every time you feel something, I want you to say what you feel. Because this will help you to connect with your feeling. And this is important for the process of treatment. So this is on daily basis. Every time you feel something, tell yourself, I feel, verbalize it. Okay, right now I feel depressed, I feel guilty, I feel ashamed, I feel mad, I feel angry. And remember to pay attention to both unpleasant and pleasant emotion. The last exercise, journaling. Journaling is one of, you need to have a notebook and to journal your feeling. You journal your thoughts, you journal your action. And then what? I just write my feeling. This is on daily basis. The most successful people in the world are, if you ask them how did you achieve this, what did you, you will find that journaling and the connecting with their feeling is part of the process of success, of healthy relationship, of successful business, of everything positive. You need to connect with your feeling and your thoughts and action. You write your feeling, how do you think about the situation, and what was their action. Okay, maybe we went through exercise one, we did it in detailed form, but I want you in journal on every day. You just write your feelings, your thoughts, and action. And sometimes I also ask my patient, I want you every night when you journal, you add 3 things that you are grateful for. Like if you 3 things, like maybe you are grateful for that you have a job, or grateful that you have kids, or grateful that you are thankful because you can walk, you can talk. This is also important in journaling. But for this session, we want to focus mainly on feeling, thoughts, and action. And some people ask me, then what? Okay, I write my thoughts and my feeling and my action. The second step, look at them. If they are rational, keep it, leave it as it is. If they are irrational, try to replace it with more rational thoughts. If you feel that you need to replace it, if you don't feel you need to replace it with anything, just to connect with it. Okay, connect with your thoughts and the action and the feeling. So I have some patients, they tell me, oh, I don't know what do you mean by feeling. I don't know. I don't know. I feel bad. They know 2 things, bad or good. I don't have any other expression or words to express my feeling. So I give them this. This is feeling wheel. The feeling wheel, it has so many feeling in it. Some people feel joy, some people feel fear, rage, anger. Anyway, like this is psychological theory for the feeling, how from what are the basic feeling and what are the secondary feeling. You don't have to go through these details. I just giving you the vocabulary that you can use when you express your feeling. You can say, I am bored, I am angry, I have joy, I have surprise, I have sadness inside me, I'm distracted, I feel loved, I feel accepted, I feel serenity. Those are kind of feeling you can print. You just type on Google feeling wheel, and then print it, and then you look at it every night if you have this problem and not able to express your feeling. I think this is the end of my session today, and thank you for joining me, and I'm gonna see you in the next episode. Thank you.